An example of that would be some of my clients will say things like, I know that's weird, or I'm just weird, or that's weird. And instead of me ignoring that, or I actually lean into it and I'll say,
Mhm.
I would love to know what's weird about that. I like when things are different or weird, right? And even
Mhm.
that interest can have them be like, what do you mean? Like, why do you want to know what's weird about it, right? Like, so
Mhm.
leaning into the things that I think they throw out and maybe don't expect someone to lean into or talk
Mhm.
about. That curiosity keeps coming up for me of like,
Mhm.
how I can use that.
Welcome to the Transforming Trauma podcast. Transforming Trauma is presented by the Complex Trauma Training Center. I'm your host, Emily Ruth, and I'm so glad you've joined us today. And now for our interview. Our guest today is Sabrena Ness, a clinical mental health counselor, clinical director, and NARM training assistant, whose work is dedicated to helping individuals and couples heal from complex developmental trauma and complex PTSD. Sabrena is a NARM master therapist who combines clinical expertise with a passion for mentoring therapists, advancing trauma-informed leadership, and creating affirming spaces for LGBTQ+ and neurodivergent communities. Please enjoy my conversation with Sabrena Ness. Okay, I'm sitting here today with Sabrena Ness. Welcome, Sabrena, to Transforming Trauma.
Thanks. It's great to be back.
Great to have you back. And as you know, we like to begin these conversations with the question, what would you like our listeners to walk away with from our conversation today?
I thought a lot about this, and I think what I really hope listeners will take away from the conversation is a deeper understanding of neurodivergent clients beyond just their behaviors and the diagnosis. I hope that clinicians specifically walk away feeling, really, I guess all humans walk away feeling curious, more compassionate, and maybe more equipped to understanding the nervous system of someone who's neurodivergent, as well as the relational experiences, even like shame and so many things that neurodivergent clients carry. I really also think that this conversation hopefully will encourage people to move away from asking what's wrong with this client or what's wrong with some of the behaviors we see, which I hear a lot from parents that I meet or when I am working with a neurodivergent client. And instead, really like, what is this person experiencing? What have they adapted to? And what are they like trying to navigate currently in their life?
So I would love for listeners that aren't familiar with you, you're obviously in our community and folks in our community may be familiar with you, but there may be listeners who don't know much about you. So could you share just a little bit about yourself and the work you're doing?
Yeah, I'd love to. So I currently live in Utah and I work for a large behavioral health company called LifeStance Health. The company operates across 33 states currently, and we're hoping to have a presence in all 50 states in the next few years, which is really great. We want to expand care for clients and make it more accessible. I've been serving the past 3 years as the clinical director over Utah. So really, my role primarily has focused on supporting providers across the state, whether that be with consultation, supervision, group support, even helping navigate really complex clinical decisions or ethical decision making. And I actually created or kind of evolved a program here to work with ADHD clients. I wanted a place for our providers to feel like they got the support they needed because there can be so many overlapping diagnoses, or it can look, is it trauma? Is it depression, anxiety? And so clinicians are told, like at master's level, clinicians are told we can diagnose this, but we're not really given the training around it. So I expanded the program that LifeStance has to really support my clinicians here in Utah to feel like they have the support of consultation, but also training materials and things like that to feel really confident in what they're looking at, specifically with ADHD, but also kind of picking up the signs of autism and knowing when to send to psych testing. That has been a big part of my work the last 3 years of supporting clinicians. More recently, though, my role is expanding into a regional clinical director. I just kind of coming into this role. And so in this next phase, I'll be supporting clinical directors who are supporting clinicians. So I'm kind of stepping a little bit further away from that, but also all those clinical directors do their own clinical work. So I'll also be supporting in the same ways So I'll be supporting 2 of our regions, over 10 states that I'll be supporting here in our central region, which Utah is a part of, and then also kind of a bunch of states in the middle, we call the Midwest. I guess in addition to that, I also see clients. So I maintain a clinical caseload and I stay connected to the therapy room and to my clients. And I feel really fortunate to work for a company that supports their clinical leaders to stay clinically active. And because of that, I really enjoy that I get the piece of leadership, but also grounded in the clinical work as well. A big part of what I'm doing here, though, I think NARM is kind of grounded in everything that I do relationally and clinically. So I know that NARM is a trauma model, but I also think the principles expand so far beyond therapy. And it really shapes for me how I understand people, how I understand my relationships, who I am as a leader, even more the way I approach supervision or collaboration with different teams and things like that. So it really just oozes kind of into every part of my work here at LifeStance.
This is so exciting, Sabrena. I just have to say, we were
Yeah.
chatting a few weeks ago or a month ago, and I
Yeah.
didn't know that you had shifted into this new role. So I'm excited for you. I'm excited for the work that you're going to continue doing in this new capacity. So I want to say congrats.
Yeah. Thank you so much. It is
Very
really
cool.
exciting. This
Yeah.
past week has been the beginning of the shift. So it's very new for me. And I'm still continuing to support Utah until we fill that role.
Hmm.
But thank you.
Yeah.
I
It's
really, really
exciting.
appreciate it. Yeah.
Yeah. Okay. So you gave us kind of just a little bit of a professional introduction. Can we rewind just a little bit about Sabrena the human? Tell us
Yeah.
a little bit about you personally and how you got into doing this work.
Yeah. So my interest in working with neurodiverse clients or neurodiversity in general is both personal, but also just naturally my clinical work over time. And maybe that's actually blends together. Part of my personal experience led me to seeing more clients that identified as neurodiverse. I was diagnosed later in life with ADHD, although looking back and talking with my parents, they say they kind of knew that I had it, but didn't really want to medicate me, so didn't look into getting a formal diagnosis. And I also was fortunate that I went to a small private school. So I got a lot of support where I know I work with a lot of kids that do not get that support or even adults who never got that support. And so on my report cards and things like that, it would often say like, Sabrina's a great student, but she's very social. We can't keep her in her seat. She's a social butterfly. So even the positive ways that they would talk about it, but at the same time, I know that there were a lot of parts of me that I was aware that I learned differently and that I took a lot longer to learn things. And luckily, I was very interested in school, so I think that helped for me. But there also are a lot of kids that are not interested in school and so shy away from learning because they feel different. And I even know, even in that environment where I felt supported, I did carry a lot of shame about the way that I learned and about, I would identify it as educational trauma and fears of looking different, things like that. So even in an environment where I felt really supported, that was there. I think I internalized pretty early that my brain worked differently. And even though I didn't have the language for that, I think that's part of where the shame came from because I didn't have the knowledge of it's okay that it's not, neurotypical, that it's neurodiverse. And it's still a lot of us on earth that feel this way and learn this way. And so I think that could have been helpful. And I hope that some of my work is supporting, kids younger to kind of understand that different doesn't always mean bad. I also worked in community mental health. So that's kind of the personal piece of ADHD. And I also have it in my family. I would say I'm not the only one diagnosed. There's a lot of research actually about developmental trauma and trauma being epigenetic. And there's not as much about neurodiverse population or neurodiversity, but what we are starting to learn is that there's some connection there and that either way it's passed down to generations in the sense of how we connect with people, different ways of learning. And now I've been talking a lot about ADHD, but I'll kind of talk even more about autism and things like that. The way we connect and communicate looks a lot different. So that makes sense that if our parents are communicating and talking that way, that's being passed down generations, whether it's through genetics or even just environment ways. But professionally, my career prior to LifeStance started in community mental health, and I worked on a youth and family team. And so I naturally started getting a lot of neurodiverse clients. I don't think I had the language at that time, but it was the kids that were struggling in school. So kids that were being labeled as defiant or oppositional, families feeling really overwhelmed and not knowing what to do. And so I noticed pretty quickly that these clients were I was using a lot of behavioral methods on them, and it wasn't working. It actually would activate them, and they would, I think, even fall behind, or we'd see some of the behaviors get worse when starting therapy, because I really don't know that a lot of those behavioral models, the way that they are, we've now seen them adapted to fit neurodiverse clients, but the way that they they're, CBT, for instance, is such a great model for many things, but just thinking about how our thoughts, beliefs, and behaviors are connected and expecting that, if I can influence one of those things, all of them will be influenced. That can be really overwhelming for someone with ADHD or autism. And so I started quickly being curious about what was underneath the behavior, why they were acting, this way, or why they were behaving this way. I didn't quite have a NARM at this time in my life, so I think it was more a lot of frustration for me, but that's where it started. And then after learning about NARM, even the beginning of like being curious and understanding how somebody connects to their own experience, that's when I really started feeling less interested in changing the behavior itself and more interested in understanding like what was beneath it. Specifically, what was their nervous system doing? What adaptations were happening, and really like what wasn't being understood about the way that the client was behaving. There was a clear difference between the clients that were defiant and these kids that I was seeing that I would have labeled, or now more not label, but notice that there was a neurodiversity to them. The core of it felt different. It wasn't just to be defiant. There was something they were struggling with deeper, that I was noticing.
Yeah.
Yeah.
So you're noticing some patterns. You're starting to track some of these things. And this is when you were in community mental health?
Yeah, that's where it started, because that's where
Okay.
my work had started. And then it carried on to, I was there for about 2 years, and then later I started at LifeStance, as originally just a full-time clinician. So I was seeing clients full-time, and that's where that's about the time I got into NARM. And so really I feel like curiosity was the biggest thing I added to it, and individually learning a client's experience. I still think curiosity is the best thing I got from NARM, is like how to be curious. And actually, I think it just brought out my natural curiosity, because us as humans, we already have so much natural curiosity. And I do feel like some of school and some of my schooling, or my master's, and as well as some of working in a really behavioral environment, which is interesting because I work in a behavioral health field now, but I do feel like I have a lot more freedom in the way that I work than working in community mental health. I feel like I am able to really, use some of the modalities, and I'm not stuck with just using behavioral things that I felt like that's all I could use before. So yeah, that curiosity became such a large part for me.
It's so interesting you're bringing forward something. I mean, we could probably spend all day talking about even just this one part, but this idea
Mhm.
of like many of us in our education, somewhere in our educational experience, we kind of learned that we needed to sort of shut down our own curiosity and like stick to the plan. And
Yes.
so isn't that fascinating that like we realize how much is missed, especially clinically, if we're not curious. And so if our master's program, our graduate program didn't like help us bring that back, or maybe even taught us to kind of shut it down in certain kinds of ways, that there's so much richness that is lost with the client when we kind of, okay, well, this is the model. I have to do this sequence or this, protocol, and don't allow ourselves to be curious. So I'm with you that for me, NARM kind of helped me reopen that door. It's like, oh yeah, I'm not only am I allowed to kind of open this door and go through this doorway and into another room, but like I should actually be curious in a more full way that I think many of us experienced in somewhere in our educational journey that we find that we've shut that down for various reasons. So
Yeah, I think I went into grad school even thinking that my job was to give advice to people.
right, how
I
many of
think
us
so
thought that?
many of us did. A
Hmm.
lot of us therapists, I think, ended up in the
Hmm.
seat because we were kind of, would give advice to our family or our friends or things like that. And then you get into grad school, you're like, wait, that's not what it is.
Hmm.
But I actually then felt like there's so many models that were then supporting, not quite giving advice, but we're supporting like telling clients what would be helpful for them.
Hmm.
And so that feels very similar to giving advice. So I very much agree with that of like NARM really supported me in realizing like I actually don't believe clients heal that way. I think we heal when we get closer to our authentic self. And so I'm so glad that I found that because I think I would have been working really differently with neurodiverse clients, but all my clients. And more research is now coming out that behavioral models don't, when they're used just the way that they were kind of created, don't support or aren't supporting the neurodiverse population. More somatic work is a lot better and can be a lot more supportive for that
Hmm.
population. So,
Yeah.
yeah.
So one thing I've been really curious to hear more from you about is, so in my own experience, and I know I've talked on other episodes about this, but my own sort of late diagnosis with ADHD. And again, I like the way you've talked about it. Like I'm not putting myself in a box around it. I realized like, oh, understanding this about myself and how my mind works and how I relate to the way my mind works, like that opened up something actually really compassionate for myself. But I totally understand when some people like there's something about getting a diagnosis that maybe that doesn't feel good to them, and I can understand that. But before I had that understanding about myself, I carried so much shame about the way my mind worked. And all through school, like you just said, I struggled with different things. I knew that I learned differently, but I just thought, the message I told myself was that I was dumb, that I couldn't pick things up. And so I'd love to hear you talk about kind of the shame piece, and then how folks that are neurodiverse or neurodivergent, the way we figure out how to mask through the world.
Yeah. Even before that, if you don't mind if I back up and talk a
Please.
little bit about, because I think it leads into this, I talk a little bit about the patterns that I've seen specifically with neurodiversity in my practice, is over time, with whether it's community mental health and then now the work that I've done, I noticed the developmental pattern, particularly with autistic clients actually through, and then in elements of ADHD as well. But starting in elementary school, it can be incredibly difficult for them. So they're really seen as it can kind of stick out more, I think, in elementary school because we're being compared to our peers a lot more. The environment has a lot more structure where we're sitting in the same classroom. And so those kids can feel immediately like I'm different. I was talking about that earlier. And then often that can become overwhelming, dysregulated. They're defiant, known as defiant kids in the room, things like that. And really, they don't have the space to navigate their environments. I do think this is changing, but I think it's still a pattern that I can see. And I actually think as they move to high school, we can start to see a little bit of that alleviated or them shift a little bit more because this is the stage where kids are experimenting with what they're wearing and figuring out who they are as a person. And so naturally, we have a lot more outliers. We
Hmm.
don't, where in elementary school, we don't see that as much. And so when I'm talking with my clients or they're sharing about kind of their journey, that pattern I've seen of like elementary school was really hard, high school got a little bit better. My differences weren't noticed as much. I also wasn't sitting in the same classroom all day long. And then actually in college is where they kind of even thrive a little bit more, depending on the support that they have, but they're able to pick an interest and kind of stick with it and really focus on that. However, then after college is typically when I would kind of meet these clients. The clients would be coming in, especially when I started working at LifeStance, when I wasn't seeing some of the younger kids. And this can be a really transitional period of like kids are now getting into relationships, maybe getting married, they're finding jobs, things like that. And so these kids are now like, oh, I don't have the structure of elementary, high school, and then college anymore. So what do I do? There's so many options that open up, and that can be very overwhelming for someone specifically with autism and neurodiversity, I guess, as a whole too, as well. And I don't like using this term, but I'm going to name it because it's something that we hear a lot. But like clients who have failure to launch is something that I hear parents talk about, or things will come in. And I think many didn't receive the environment that they needed at this time, but that's what lands them in the room with me. Parents are very frustrated. They're like, I want my kid to be doing all the typical things that other kids are doing at this age. They need to get a job, but they don't. What's going to happen to them when we're no longer here? There's lots of fears around it. And then that is, I mean, one of the many things that also leads to shame at this point in their lives of like, even I've talked with neurodiverse clients that are asking questions like, I want to have relationships with people. I want to get a job. I just don't know what to do. The environment just isn't set up for it. And I would say a lot of my work is supporting them to find environments that are set up, finding programs. Some of them that would be more of an IOP or even residential places, depending on their age. But for some, it can just be environments that they can, live at home, but also go and kind of get the support that they need. And so shame, of course, started in elementary school and then maybe shifted throughout their life. But that's a common theme, is the shame underneath all of that. Also, I think such pure intentions, parents are fearful for their kids, but that fear and anxiety that they're experiencing puts a lot on a kiddo. And also at that point, they're like, okay, I am different. This is coming back up again. I'm different. This is bad because there's lots of fears around what's going to happen to me. And so I think that can really create a lot of shame. And I would say clients aren't often coming in and using the word shame, but I actually have to this day not worked with a client that is in neurodiverse population, maybe all clients, but in that population that doesn't in some way talk about shame, about what is happening for them. And I don't actually think it's about their neurodiversity. I think it's about the environment that they didn't have and the supports that they didn't have, which create this shame for them and really misunderstanding about what they need. And so that kind of leads into your question now a little bit more. Um, yeah. Originally, I think my first experience with that I can think of with working with, or not even working with, but neurodiversity is in high school. I guess it was working because I was like a care assistant for a classmate, and he lived in my neighborhood, and I would just get him home after school, help walk with him, so it felt normal that he was in the same grade as me. So he was walking home with a peer, and then I would help him support himself to take medications and things like that, and then spend time with them. And I remember a lot of the things he would say would be, I want to do this. I want to hang out. I want to have a girlfriend. I want to, create friendships like that. And almost for him, it wasn't an awareness of his differences. Like he felt like he was very similar and didn't get it. So I also think there's a problem with not embracing the differences and not teaching like I'm different and that's okay. If we looked at every human that way, it would feel less stigmatizing for someone who is neurodiverse. That just like popped into my head. I hadn't even thought about that work that I had done early on. And I'm sure that led into me even becoming a therapist and all of that.
That's so rich. And again, you're helping me just kind of reflect on my own experience. I think that is something that, at least for me, there was a shift in how I was relating to it. Like you're saying, like rather than thinking of myself as like, oh, it takes me longer to pick things up. For instance, math was so difficult for me and I had to study so hard. And I studied so hard. It's like once it was in my brain, it sticks. So like years later, I worked as a substitute teacher and my favorite classes to teach were math because I still remembered it because I had to study so hard. It's like there's something really interesting about me sort of holding that as a strength. Whereas years before, I was like, oh, I have to study so hard. But yeah, reorienting and creating a different relationship to, oh, this isn't a bad thing. This is just how my mind works. And then here's kind of the flip side of that is actually really supportive to me. So I love that you brought that up.
Yeah, I share that. This is something I've learned to embrace in my life, but nothing really comes easy to me. Not many things come easy. I actually used to joke with friends and partners and things that the thing that does come easy to me is connecting with people.
Mm-hmm.
Outside of that, I have to work at pretty much everything else.
Same.
And honestly, I think that's that's an okay skill if I'm going to have
Yeah.
one. I love that it's connecting with people, and so I think that's actually was a superpower of mine.
Yeah.
And when it could have been looked at very differently because I did
Mm-hmm.
connect in some ways differently than other people. I don't I don't love surface level conversations. I like to go deep very quickly. And so I think that could be looked at as very overwhelming or it can be hard, but it was embraced in me and I now obviously that's why I think it makes me a
Yeah.
great therapist
Yeah.
and I enjoy the work that I do. So
Mm-hmm.
it's interesting that we share that similar pattern
Mm-hmm.
in our journeys.
Yeah. Yeah. So can you come back to the shame piece? Sorry, I took a little side trip there, but
No, love that.
yeah. Yeah. Share a little bit more about that if you would.
Yeah, I think when someone grows up receiving repeated messages, whether it's directly or indirectly, that they're too much, they're not enough, you're always distracted, you're disorganized. I mean, and some of these things I'm naming can fit many different neurodiverse. We're talking about ADHD and autism, but I mean, this can also be clients with epilepsy, dyslexia, other learning disabilities that aren't talked about as much, but they all are part of this neurodiverse community. Also being told we're over emotional or just not doing things right. That's wrong. This is wrong. I don't know if you have that experience, but I have a repeated memory of saying, you're not doing that right. Again, whether it was indirectly or directly, like re-showing me how to do something and that carried as a young kid up, it still, I think, happens in my life. I look at it differently now, but setting the stage for that, like, if that's happening all the time, it makes sense that shame starts to build over time. We're told I'm doing it wrong and this isn't right. And I think one way that shame shows up clinically is through masking. I have clients that will come in and work with me, and I can see that they're giving me a clinical answer, or they're giving me an atypical answer based on what they learned in the environment. And so a big part of working with the shame and working with clients is I feel like I notice masking happens when there is a lot of shame. It's a way to hide the shame or to look normal, if we want to say that. And so when I notice masking, I actually recognize it as I need to build a stronger relationship with this person because I think the relational piece can be so important in helping them feel like they can take off those masks and they can be present in the
Yeah.
session.
And how are you doing that? And I know that's that's a really big question.
Yeah, I think it's about being curious about their experience, going back to that. And I think when I'm curious and I'm excited to learn about them, even like sharing interests or if they talked about something when they come in the next week, bringing that up can show that, oh, you're thought about me, you're thinking about me. Like, I think that's really important for someone because a lot of times they can think they're an annoyance to people. That's very true about my experience. So when somebody is interested in me, I mean, it goes back to that basic skill of just being interested in our clients. When I see that masking and I go back to that, there's so much rich material I learn about them and I can support in them. And really, masking is an adaptation. It's learning how to present in a way that feels more acceptable and more aligned and in the way people so that they don't feel criticized or disconnected or rejected. So when I lean into the parts of them that are more neurodiverse or I'm interested in those parts, I think it can help with them feeling like, oh, I'm not rejected. I'm not being criticized. I'm being actually asked more questions about this, which can be so complex and tricky for a clinician. I want to
Yeah.
just name that. I get it wrong all the time. I'll start asking questions about something and I'm like, oh, this is a piece of masking. This isn't, or I'm holding that maybe this is a piece of masking. I don't quite know unless the client shares it with me, but sometimes I get it wrong in that sense. But I learn a lot from then when something does feel like it's their authentic self and they're actually more connected to who they are authentically. Yeah.
Yeah. As you're talking, I'm just like, it just is so healing to have
Mm.
someone legitimately interested. I mean, I think all humans, right? It's like we all want to know that that whoever's in front of us talking to us, that they want to be there, that they're actually curious about whatever our experience is. And so, but I'm just thinking about someone who hasn't had much of that experience because they've been told, oh, that's annoying, or this aspect of yourself is too much, or, whatever that is, that it's like especially healing to
Mhm.
feel the curiosity and the genuine interest. So yeah, even just hearing you
Yeah.
talk about it, I'm like feeling my body just sort of like relaxing, like, yeah, that's where it's at.
As we were saying that to us, I thought about an example of that would be some of my clients will say things like, I know that's weird, or I'm just weird, or that's weird. And instead of me ignoring that, or I actually lean into it and I'll say,
Hmm.
I would love to know what's weird about that. I like when things are different or weird, right? And
Hmm.
even that interest can have them be like, what do you mean? Like, why do you want to know what's weird about it, right? Like, so
Hmm.
and then eventually we get to a place where we're talking about it that why is it weird? What is so weird
Hmm.
about it? So I think it's just like being leaning into the things that I think they throw out and maybe don't expect someone to lean into or talk
Hmm.
about. That curiosity keeps coming up for me of
Hmm.
like, how I can use that. And some of the ways I see it with clients, the masking is like overcompensating. It might show up as like perfectionism, people pleasing. And so these are all things we see in, all of our clients, but also monitoring how something's coming across, like waiting to see how I receive it. I notice is something that happens with my neurodiverse clients, even maybe more than the rest of the clients that I see, is just this piece of like, how are you going to respond to something I just said? Or if I said something randomly and it didn't fit into the conversation or whatnot.
Cool. I'm just feeling excited about all the folks that you're impacting, and now in this new role, how you're going to help, other clinicians, if this isn't something that they're really thinking about, because I think all of us at some point are going to work with neurodiverse folks. And so I'm just really appreciating the impact that you're having on the community and the work that you're doing. I'm
Thank
curious
you.
because everything you've said so far really applies to anyone working with really any model. I mean, this idea of curiosity, how we're holding neurodivergence, kind of our relationship to it. I'm curious again to bring you back to the like when you started working with NARM, why does that feel like it's a clinical fit? And maybe are there times that it's not? Maybe if you could kind of start there.
Yeah, I think one of the reasons why I think it's fits more is it slows down naturally. The things that I think are supportive for a neurodiverse client is can be like pacing in a session is one of the biggest things, like ensuring that I'm kind of staying with them, or I think it's a lot of times it's a lot slower. I'm careful about saying that because that's not true. I think we can see this with clients that experience a lot of trauma as well. But I think the pacing and I think the curiosity piece and the piece of wanting to understand their internal experience, which is a big part of NARM, and the model itself of the different questions that we can ask, I think can be really supportive. I actually could go the other way with that. And I know, Emily, we've actually touched on that before in an outside conversation about how sometimes the contracting question can be really activating. I've seen that really activating for clients. And then also I've seen it really supportive. So NARM naturally has all the principles that I think are really needed to work with a neurodiverse population. It can't be rigid. It can't, you have to really kind of grow the way you're working with a client as you're learning about them, which is what I think is can be so important about it.
So what I'm thinking about, you mentioned pacing, and maybe for folks that if they're not trained in the NARM model or they're not familiar with the pillars, or maybe they're using a different model, or the idea of pacing, they're not quite sure what that means. I'm wondering if you could talk about what about the pacing of NARM is supportive in working with the neurodivergent clients, and when might you adjust it?
Yeah, great. I think to answer that last piece, when you might adjust it would be throughout the whole time adjusting it, but I love the question and talking a little bit more about this. For someone who's not as familiar with NARM, there's something we call contracting in the beginning where we're trying to understand what the client wants for themselves. And I actually think that question in itself, the way we start sessions, so I typically will say, what is it that you want out of our time together today? Might frame that differently or bring up something we've talked about from the past to see if they want to continue on that topic. But I think right there, we're jumping into the core of what the client wants, and then I'm continuing to stay on that thread, like that what they end up wanting for themselves is what I continue to come back to and understand what leads them away from what they want for themselves, as well as what connects them to what they want for themselves. And I'm not doing it in a way that gets me somewhere, which I think can be different than other models. NARM is really about exploration for the purpose of exploration. The model continues into deconstructing an experience for a client, and that is really spending a lot of time on an experience that helped them feel more connected to what they want for themselves, or the opposite, a time when they didn't feel connected to it. And so I think a big part of this too is NARM itself is built on, as I mentioned, curiosity rather than correction. And I think a lot of behavioral models, you can do them very relationally. So as much as they can be supportive, I think naturally they can start to create more shame if it sounds like I'm correcting a behavior, or why don't
Mhm.
you just say this instead, or you talk this way instead? That can be a lot of behavioral work of like learning how to communicate rather than learning how they communicate and why they communicate that way, which is for me, the pacing of for NARM is going to be really just slowing down and sticking with some of those key moments and not rushing to get somewhere, which I think is such a big part of the pacing. And we're also learning about what's happening inside for that client. I'm not necessarily dropping into that if they're not bringing it up, but I'm curious about how they have adapted or the way that they are viewing a certain situation. To share a little bit more about NARM, it's both a top-down and a bottom-up approach, which I think supports the neurodiverse population with this as because of this as well. So we're not just working cognitively with our thoughts and our behaviors, but we're also paying attention to our body, our nervous system, the relational patterns that we are experiencing, and also how I'm experiencing things right now in this moment. I've noticed that my clients might get activated, and like if they're talking about an experience as if they're there, they can really experience it. They have very deep emotions, and it can even be an emotion of empathy. And so I think, we're really slowing down and supporting them both top down and bottom up, and pausing at that. I think because we're doing that, it is a slower pace, moving kind of session. Or it might look like we only talked about one thing, but we like really stretched out to try to understand that one thing for the client in a session. And I would also say I have sessions where we talk about a lot of things because some of my ADHD clients will kind of ramble. But what's great about NARM is I then can take my curiosity about why their brain went there and say how it's connected to what they want for themselves. There's like always that driving force.
When you were talking, something came up for me, and I don't know how much you're working with couples, Sabrena. Do you work
Mhm.
with many couples?
I do actually right now a lot.
Yeah. And I'm thinking about how when I'm working with a couple, if one or both partners are experiencing a neurodivergence in their own experience and how that, how that comes into the relationship. And again, we could probably spend a whole nother episode talking about couples and neurodivergence. But what you're naming here feels so supportive in this understanding, not to try to just behaviorally change. Why don't you say it like this to your partner of like, well, why are you communicating like that with your partner, and getting really curious about it. So
Mhm. Yeah.
anyway, I just wanted to name that, and I wondered if you had anything to say from what what you've
I
learned.
do. There's something I can't say that this is a statistic out there, but something I've seen several times in my work with couples is couples that are made up of one client that has ADHD and another that has autism.
Autism. It's an interesting pairing, and it happens a lot,
Yeah.
doesn't it? Yeah,
Yeah, and I think part of what I actually think it happens because there's something that really complements these
I
two
think so.
different, ways that we work and the ways that we operate. this is only one kind of presentation of it, but somebody with autism maybe can present as a lot more internal and quiet and maybe take some time to think about things before they say it. And then their partner has ADHD and is a lot more the life of the party and very rapid speaking and things like
Hmm.
that. So I think you can be drawn to that in somebody else. And the work that I've done with couples is learning about the opposite of that person, because what drew you to them sometimes also can be really difficult because it, like, bumps up against the way that you operate.
Hmm.
And so I think what's so wonderful about NARM too is it's like, yeah, we're not just talking about, like, let's compromise and find a way to communicate. Because I think sometimes when we, maybe therapists, this will be a hot take, but, like, compromising, I think nobody gets what they want.
Right. Hmm.
I don't know if that's the answer. And
Yeah.
so looking at just, like, learning more about my partner and learning more about, like, how they are as a human, there's actually then more compassion and connection there. And I would
Yeah.
say a lot of my couples, whether they come in right away saying this or we get to that eventually, but there's always ends up being a goal around, like, we just want to connect. It's actually not that we want better communication, or which they
Hmm.
do, but it's actually that I want to feel more connected. And I don't when my partner doesn't understand the way that I operate or work. So yeah, I totally
Yeah.
agree with that.
Yeah. It's really beautiful how NARM can be so, yeah, just baked into working with couples. And most of us, you know, we took the NARM training thinking this is just a trauma model to work with individuals, and how beautifully it works with couples as well. So I love that you went there.
I just thought about also something with NARM and the structure of it, or is the flexibility, but at the same time the structure of it. I kind of said that, but, like, the it being so structured, I wouldn't say that it's just, like, client led and let them talk about whatever they want to talk about.
Hmm.
And I actually think clients really, all clients, but my neurodiverse clients really like that. They
Hmm.
they they can see the intention behind my questions, and I think that can be really, really helpful. I maybe mentioned on this earlier, but clients also can get activated by, I've had some neurodivergent clients that are activated by the question of what do you want for yourself? Being connected to that desire, I think, can be really overwhelming. And so I might phrase the question differently, but so much of, like, the principles of being curious and flexible and having a structure in the and why I'm asking something, maybe not how I ask it in this sense, but it that still is so supportive for those clients. And so I might have to adjust the way that I'm asking questions, or even frame them more in open, like, ended phrases rather than even a question, because I think a
Hmm.
question itself can create some, like, dysregulation for clients.
Yeah. Okay. So you're talking about this is one way that you're adapting the model. Are there
Yeah.
any other ways that you find yourself adapting NARM working with neurodivergent clients?
Yeah, I think I mentioned this earlier, but there is still also a lot of case management, maybe. But even in that, I'm very curious about what they're looking for and what they want. A lot of it is helping them find the resources, as I mentioned. So
Hmm.
maybe that is not, it's a different kind of layer of therapy in itself. And
Hmm.
I would say there's some of that with all of my neurodivergent clients, that we're talking about resources or ways that they can get support. But it's not about you need all these things so that you can be more normal or that you can be
Hmm.
more, neurotypical. It's so much more about what would support you and what you want and the life that you wanna live, and so I'm looking at even resources in that way. And so I think that's
Yeah.
another way that I've adapted, you know, NARM to kind of fit and work with that
I
population.
love that. I've not really thought about it in that way though, but that when we're providing these resources there, I mean, it's kind of nuanced, but it's like that's actually a huge difference in how you're relating to it. I'm not giving you this resource so you can sort of fit in this neurotypical box. It's like, what are you actually wanting from the experience, whatever that may be? And how can, a resource, maybe this resource will help you experience that. That is really quite different, actually. I imagine that really can shift, again, their relationship to a resource or whatever that is.
I also think it helps clients feel they can trust in why I'm bringing up a certain resource or why I'm talking about resources in general, when they feel that I'm not trying to change them or fix something that, act as if they're broken in some way. And so I think then they're more open to learning about a resource because I'm sure throughout their life they've been thrown different reasons. Just, put you in this room in school or give you this fidget toy and you'll be fine, and
Yeah.
I am actually hearing a lot more success stories from schools and stuff. So I don't mean to say that that hasn't shifted or changed because it
Hmm.
really has, but I also still hear, that. And so they can look at even the idea of resources means I'm lacking in something.
Hmm. Yeah. Yeah. I just so appreciate how you're helping us think about just our approach, when we're even something like sharing a resource that I'm hearing you say they can trust kind of my intention around sharing something, that it's not to fix or change them, but it's really just, I think this might be supportive of what you were saying that you wanted for yourself, that there's a very different intention there. So, wow.
Yeah.
Well, Sabrena, I want to check in. Was there anything else that I didn't ask or that you would want to kind of explore with our listeners before we close?
Something I don't know where it fits into this, but something that's coming up for me is we didn't talk really about stigma around this. I mean, it was touched on, but I think about the positive shifts, even just leaving kind of the podcast with that, with even seeing more neurodiverse clients in the media. I mean, young Sheldon, we have like the Good Doctor, I think that might be what it's called. And I
Hmm.
think although those are very positive and are making shifts towards it, we also see only one type of like autism that's showing is like the really intelligent human that also struggles with social cues and relationships. And I hope that we can look at a broader view of what neurodiversity means rather than just that piece of it. I think it's great that it's out there, but my hope is that we start to see characters being played that show all different types of neurodiversity, as well as like even the over empathizing type. We don't see that as much. Someone who can have so much care and compassion for someone else that it feels overwhelming in their body. I would love to see more of that in the media. I also was listening to a podcast, and I wish I could remember the name of it, but this doctor loved to talk about neurodiversity rather than on a spectrum, but like with spices. And I think there was a lot of stigma that was taken out of this idea that we're on a spectrum, which in itself says I'm high functioning or low functioning, which can be very stigmatizing. And instead, he talked about it like a spice cabinet. And some have 2 or 3 spices. Some of us have all the spices in there. And so it's like, it's just whatever your flavor is. Some people like, and so I maybe a lot of paprika and a little bit of salt. And so I loved that idea of it. And it made it less this idea that something is good or bad, or I'm high, I don't know, high functioning or low functioning. And so I thought that was to be such a beautiful way to end this, is to thinking about your neurodiversity as in what spices you have or what makes you up, because all the spices are important, right? We don't talk about in cooking that this one might not be in this recipe, but we don't treat it like it's a bad spice or something. So I loved that piece of what he brought into that, and I wish I remembered the podcast, but
Yes, I am so delighted by that. I'm really appreciating like that is sticking with me. I'm smiling really big. Something about that feels really important to me.
yeah.
Hopefully our listeners, yeah. Anyway, I'm sure that will be supportive to others just like it is me. So,
Yeah, it's exciting to figure out too what
yeah.
spices you are maybe made
Hmm.
up of you, and I love that
I love
idea.
it. Yeah, that's so great.
Yeah.
Oh, Sabrena, every time we chat, I'm just so happy that I get to be connected to you and appreciative of the work you're doing and appreciative that you're willing to come on this platform and share your experiences and your wisdom and all the things that you're continuing to learn with our community. So thank you for coming.
Yeah, Emily, I feel the same. I really enjoy coming and talking on this podcast with you because I feel like, we're friends outside of this, and there's just like a connection piece of having a conversation like we have in a car or sitting in a park or something, and just being able to talk about these things. And
Yeah.
I hope that is what this kind of feels like for other people too. So
Awesome. Well, thank you again. For folks that are wanting to kind of be in contact with your work, is there anything that you can kind of share? Where can folks find more about the work that you're doing?
yeah, you can find information about me on lifestancehealth.com website, searching my name. That kind of gets you to my profile and my contact information if you wanted to connect.
Okay, fantastic. Well, thanks again. Appreciate you.
Of course.
Thanks so much for joining us for today's episode. To find more information about our guest, check the show notes or visit us at complextraumatrainingcenter.com/transforming trauma. Our spring 2027 NARM therapist training is designed to help you expand what's possible in your trauma work. This live online program offers a structured, clinically grounded way to build more precision, confidence, and effectiveness in treating complex trauma and adverse childhood experiences. If you're ready to strengthen your clinical impact and work with greater depth, we invite you to join us to get trained in the NeuroAffective Relational Model. Enrollment is now open and space is limited. Visit complextraumatrainingcenter.com to learn more and apply.